Hello everyone. So today we are here to discuss the COVID-19 treatment strategies or protocol. It is provided by the AIMS New Delhi and it is a very important topic for all the healthcare personnel to know. Not only that, also it is important for students who are appearing for PG exams. So let us start. So first we will try to know who is a COVID-19 suspect. So first of all, you need to see some symptoms in those patients, right? So here in these patients, you will find fever, and out of these two, cough and shortness of breath, at least one should be present. Or there may be a close contact with the confirmed case within 14 days again. Along with this, there should be a history of travel to these COVID-19 affected countries within 14 days. And finally, the doctors, nurses, and healthcare personnel who are actually managing cases in the hospital and they have come in contact with these COVID-19 patients and they are having some symptoms. So all of these people, they may come under this COVID-19 suspect. Now we may classify the cases into mild case or moderate to severe cases. So first let us find out what is a mild case. So a mild case will have low grade fever, cough, malaise, rhinorrhea or sore throat without any shortness of breath. And all these symptoms are not present together. In some patients, some symptoms may be missing. So you have to judge clinical. So what is the treatment of this kind of mild cases? So you can use tablet oseltamivir 75 mg twice daily. This is especially for people or patients who have increased risk of influenza. Along with that, you can also use antibiotics, for example, azithromycin, along with amoxiclav, which is amoxicillin clavulanic acid. Okay. Also, because of this low-grade fever, you can also use paracetamol 500 mg SOS as required. So these days, there are multiple helplines and announcements made in media about these symptoms of this disease, and that's why people are aware of the symptoms. And so whenever they find out that they have the same symptoms, they usually call the helpline. So what happens after that? So these helplines provide us with a specific set of questionnaires or tests. So depending upon the result of this test, either positive or negative, we will treat accordingly. So if the test is negative, then we will do symptomatic management for upper respiratory tract infection. And on the other hand, if the test is positive, then we will follow some steps. So what is the first step? It is home isolation. Home isolation means 7 days after the onset of the symptoms, you have to stay at home. Or if you are having more than 3 days without fever and 2 negative samples 24 hours apart, means 1 day apart. So if you are doing one test today and the same test is performed in the same time tomorrow, and if both of them are negative, then it's fine. Also, what the patient can do is self-monitoring for the fever. Suppose daily you can check for the temperature twice. And of course, for the fever, paracetamol can be used and symptomatic management can be done. Other than that, the patients have to follow contact and droplet precautions. So what do you mean by this droplet precaution? It means that everyone must clean their hands, including before entering and when leaving the room with the sanitizer. It is easily available in the market these days. And also you have to make sure that the eyes, nose and mouth are fully covered before entering into a room. And you have to, before exiting the room, you have to remove that face protection or mask. And what do you mean by contact precaution? Means everyone must clean their hands with sanitizer, including before entering the room and when leaving the room. And provider and staff, those who are providing the health care, this healthcare personnel, they should put on gloves before entering the room, discard the gloves before they exit the room. Also, they have to put on a gown before room entry and you have to discard the same gown before exiting the room. And also, one more thing important to mention over here, that you cannot wear the same gown and gloves for the care of more than one person. Along with that, use of dedicated or disposable equipment should be there. And also sometimes suppose you are using a stethoscope, so clean and disinfect those reusable equipment before they can be passed on to another person or another room. Okay. So what to do in high risk patients? So you will have to admit those people in hospital. Who are high risk patients? The people who are old age. For example, more than 60 years of age, who have cardiovascular disease, for example, hypertension, and for people who have diabetes mellitus, or for some reason they are immunocompromised. And also those patients who have chronic lung disease or kidney disease or liver disease. So they have to be admitted to the hospital because they are high risk patients. Now let us move into who are moderate and severe cases. So there are 4 criteria, and at least one criteria should be there in moderate and severe cases. Number 1 is respiratory rate should be more than 24 per minute, or the SpO2 should be less than 94% in room air. SpO2 here means the saturation of oxygen. Okay, there are a lot of equipments available in which you can measure that. Okay, number 3 is if there is confusion or drowsiness in those patients. And lastly, if the systolic blood pressure is less than 90 or diastolic is less than 60 millimeter of mercury. So in these patients, what to do? They are moderate or severe cases. So we have to admit those patients in the hospital. And next thing we have to do is to undergo some laboratory tests. So depending upon the test results, it may be negative or it may be positive. For these patients, we have to ensure that the SpO2 should be more than 94%. So we have to provide them oxygen. Also, we have to give them antipyretics and antitussives and antibiotics as they need. So antibiotics for the fever, antitussives for the cough, and the antibiotics for the infection in general, respiratory infections. So for negative results, you have to manage according to the protocol. We have already covered that symptomatic treatment of upper respiratory tract infection and for mild cases. So depending upon that, you have to treat. What about the people who are positive and laboratory confirmed? And also, here metered dose inhaler are preferred over nebulization. The next drug that can be used is hydroxychloroquine. So on the first day, we have to provide 400 milligram twice daily for the first day only. And the next day, we will just halve the dose to 200 milligrams twice daily, and we will continue this for 5 days. So we all know about hydroxychloroquine. It is sold under the brand name of Plaquenil, and basically it was initially used as a treatment of malaria and sometimes even in treatment of rheumatoid arthritis, lupus, and porphyria cutanea tarda. So if you're not using this hydroxychloroquine, then your next option is lopinavir or ritonavir. You have to use a dose of 200 milligram, 2 tablet twice daily. And this should be done within 10 days of the first onset of symptoms. So we already know about ritonavir. It is an antiretroviral medication used along with other medications to treat HIV or AIDS. And it is also a part or component of the highly active antiretroviral therapy, HAART. We already know about that. So it belongs to a class of protease inhibitors, and this drug interferes with enzyme protease, which is used by the HIV infected cells to make new viruses. And one important thing to note over here is that we cannot combine hydroxychloroquine and lopinavir. So basically there is a pharmacokinetic interaction between these two drugs, so we cannot use them together. Also, we have to avoid using corticosteroids because they decrease our immunity. So all these things we will follow in those patients who are moderate to severe cases. Now, next thing, we have to find out whether these patients are worsening or improving. If they are worsening, what to do and how to identify whether they are worsening. Let's find out. So if the patient is worsening, then we will see respiratory failure or hypotension or decrease in the mental status of the patient. So that is how we will find. Also, there may be multi-organ failure. So in these patients, what to do is, so for these patients, they have to be admitted to the ICU for even better management. In ICU, we have much better prospects for treatment of these serious patients because there some very sophisticated equipments are usually available. The patients can be provided with non-invasive ventilation, or even high flow nasal cannula can be used, and the ventilator should be used according to the ARDS protocol. Along with that, fluid management should be done depending upon the dehydration status of the patient, and a standard care should be provided. Also, one important thing to note over here is that we have to provide closed suction and we have to use HME filters. HME means heat and moisture exchange filters. Along with this, the prone ventilation should be used, and if the patient is suffering from refractory hypoxemia, then we have to use ECMO, which means extracorporeal membrane oxygenation. For example, if some organ is not working within the body, then we can perform the same activities by taking the same function outside the body. So extracorporeal means out of the body. Now, if after doing all these in the severe patients, if we see that there is an improving status clinically and by laboratory tests also, then what we will do? We will discharge the patient if the patient, after taking 2 negative samples at least 1 day apart, means 24 hours apart. Now, after discussing all this, we are left with just one more thing, is that what to do in asymptomatic patients. These were all symptomatic patients, these mild cases, severe cases, but what to do if the patient is asymptomatic and also has a history of contact with such a kind of patient or is a traveler from those COVID countries. So in these patients, what is used is home quarantine. That is the best way. And along with that, from time to time, they will do self temperature checkups and also maintain a droplet and contact precaution, as we have also discussed earlier. So these are the basic strategies that are being followed in India, in the hospitals here, for the treatment of such kind of patients who are suffering from COVID-19. Though new treatment strategies are coming out daily, we will discuss about those too in coming videos. Thank you everyone for a patient hearing.